Hello, Ronnie Smith, RRT, coming back to you. Today I want to talk about oxygen administration devices. Now I'm just going to touch up on just a couple that you're probably going to be seeing in the hospital. Okay. Number one is the nasal cannula, the one that goes around people's nose, into their ears, and goes around into their nose. You run it between 1 to 6 liters. That's where I would put it at. Remember, 1 liter starts off at 24%. Then for every liter over that, you add 4. Okay. When you get up to 6 liters, you get to 44%. Okay. Why do we put oxygen on someone? Let me just say that. Because to decrease myocardial workload, person who is having trouble breathing, someone who is hypoxic, someone who has smoke inhalation, someone who has COPD, who maybe has pneumonia. That's why we give them oxygen, just to supplement what their oxygen is. It should be, say. The way we check is with a pulse oximeter on the finger or arterial blood gas. But getting on, let's go to a simple mask. We run it between 6 to 10 liters. Now, I cannot stress this enough, and I've seen this happen many times in the hospital. You cannot run a simple mask below 5 liters. Okay? It has to be 5 or greater. But on the safe side, 6 to 10. Okay? The reason you cannot run a mask less than 5 is because when you have that mask on someone, when someone exhales, they're exhaling what? CO2. Inhaling oxygen, exhaling CO2. Okay? Now, if there's something over this person's mouth, nose, what they're going to be doing is when they exhale that CO2, when they breathe in, they're going to be rebreathing their own CO2. Okay? So we have to run the mask at between 6 to 10 or above 5 to flush out that CO2 that's inside. Okay? So you run it at, say, 6 liters. You exhale. Oxygen's pushing the CO2 out at the portholes, and when you breathe in, you're breathing in pure oxygen. Okay? So that's a biggie. So keep in mind, watch that. Okay? Because sometimes I've walked in people's rooms and they've had the simple mask set at 2 liters. One time, someone set it at 1 liter. And one time it was really scary. They just turned the flow meter off, left the mask on them. Okay? Basically, it's like taking a pillow, putting it over someone's face. You're slowly suffocating them. Okay? So watch out for that. Next mask is a partial non-rebreather. Now, you gotta be tricky with this one. This was going to deliver somewhere between 80+% oxygen. Okay? Now, you want to watch with this one, not to hook it up to a flow meter. I mean, you want to hook it up to a flow meter, but what I'm saying, don't hook it up to a humidifier bottle. Okay? Because the condensation will fill in the reservoir bag. So what you want to do is, when you adjust the flow meter, the flow is usually going to be between 12 and 15 liters. Okay? And textbook says, watch the person breathe in. When the bag collapses a little bit, that's good. Okay? Some therapists just turn on 12 or 12 to 15 and just leave it there. Okay? So what you want to do is, one moment. You say?
Thank you.
You're welcome. Oh, baby girl. What you want to do in an emergency situation, just between 12 and 15. Okay? If you want to, put it on 15 in an emergency situation, especially if someone's coming in very, very short of breath and their pulse ox is really low. Do that. The next mask is a Entrainement Mask. Now, you have to watch this because the flow rate, there's 3 things you got to watch. The flow rate, the size of the jet, and the portholes. Okay? Because usually with a lot of them, the little nozzle, the jet nozzle, will tell you what flow it needs to be on. Okay? So you just hook it into the mask, You adjust the flow, and it's going to give you exactly that precise amount of oxygen. And it's not going to be exactly 100% on, but it will be close to that number. Okay. Some have like the little adjustable portholes where you adjust it, you adjust the mask, and then you adjust the flow meter. Okay. And what that does is, as that oxygen is flowing through the tube into the mask, those portholes will actually capture room air and blend it with it, and allow the oxygen to be delivered to the patient. You can hook up humidification to it. Not going to be a problem. Another type of oxygen administration device is like a nasal cannula, which you actually insert into someone's nose and you adjust the flow accordingly. It's roughly, I've never seen one in the hospital, but you adjust it just like you would a nasal cannula. Another type of nasal cannula is nasal cannula pendant. Well, what this is, it's like regular nasal cannula, but it has like a little pendant you wear, like a necklace. And what that does is when you adjust the oxygen, you can adjust the oxygen down low, and what happens is that little pendant, which is like a little round ball that sits in the middle of the person's chest, that fills with oxygen. Okay? And so they have a reservoir. So you've turned a nasal cannula into a big reservoir. Okay? Which is really neat. I've only, in 6 years working in the hospital, I only actually put one of those on a patient. So they're rare. They're normally with home care companies. Okay. Another one is the nasal cannula Mustache, which I've never seen one. I've never seen them in a hospital. I've never seen them in a home care company I used to work for. Basically, what it is, it's just like a nasal cannula with like a, it looks like a big hot dog that sits directly under the nose. I don't like them personally, but they're out there. Some companies, some hospitals still use them. I personally don't like them. Another type of oxygen administration device is the type that is inserted into the neck. This has a pretty good advantage because what it does, it actually uses the upper airway as a reservoir. So you can turn the flow down low. The patient exhales, and as they're exhaling, that cannula that's inserted into their neck is actually filling up their upper airway with oxygen. So when they inhale, the upper airway, like I said, becomes a reservoir. Okay? And remember your flow rates. Okay? That's one of the most important things. Like I said earlier, 1 liter is 24%. For every liter over that, you add 4. So 1 liter is 24. 2 liters is 28. 3 liters is 32%. 4 liters is 36%. 5 liters is 40%. 6 liters, 44%. Okay? So just keep that in mind. Definitely familiarize yourself with all the oxygen administration devices in your hospital. And most definitely be ready to answer questions from patients, especially those who are going home on oxygen, about the tanks. Normally the ones they use in the hospital are little small E-tanks. Show them how to put the regulator valve on. Show them the do's and don'ts of oxygen, which you students who are watching this and therapists who've been out of practice for a while are watching. You know. You know what happened with a tank that's pressurized 1200 psi's of pressure. If that neck would come off, what would happen? It would go right through a brick wall. Okay? So keep that in mind. That's all I have for you now. I'm planning on making some more videos. These are just tips on what to do in the hospital. Okay, definitely consult your instructors. Look it up on the internet. Definitely read your textbooks and keep your textbooks. I still have mine. All right. And only thing I can say to students out there who are wanting to get into respiratory, study. Study, 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 study. Sacrifices you make now will pay off in the end, okay? So fill this up with as much knowledge as you can, because keep in mind, you can learn everything and still this will not be full. Alright? This is unending. Okay? So once again, this is Ronnie Smith, RRT, signing off. Take care and God bless.